Hi, this is Tammy McClish. Let's go ahead and take a look at educational theory. Best practice is a buzzword often selected when a professional is looking for confirmation that the plan chosen is the most effective for their profession. As a medical assisting program director, I have spent countless hours making sure that best practice is adhered to as I align the program with our accreditation standards. Most medical assisting directors and faculties are content experts, and as such, may have not been given the opportunity to train as an educator. So program directors need to consider best practice when they're developing a training program that incorporates educational theory for medical assisting faculty, and to call upon educators that are content experts in education. Now, thankfully, I do have 2 master's degrees in education, and I'm currently working on my doctorate in education. So hopefully I will be able to give you some insight into what you need to understand in order to be an amazing educator. Educational theory actually began in 1966. There was a gentleman, and his name was P.H. Hurst, and he had the opinion that educational theory is an essential background to rational educational practice. Hurst affirmed that resources of educational theory consisted of reasons for educational principles that are of empirical, philosophical, moral, or other logical kinds. A variety of educational theories exist, but in 2012 there was a gentleman named Denick who suggested the following theories apply to health profession education. And those theories are the constructivist theory, experiential learning theory, and the humanistic theory. Denick states that the constructivist view of learning is concerned with how learners construct an understanding of the world. Denick provided the following tips to enhance learning as it relates to the constructivist theory. Tip 1 is that we should ascertain and activate the prior knowledge. Now remember, a lot of the students that are coming to us may have had classroom experiences in the health professions, or they may have just had a health class in high school or college. So it's important that we take a look at their prior knowledge and we activate that prior knowledge when we're talking about our individual topics. On the first day, I tend to look at all of my students and I get a good idea of what they're bringing to the table. I have them fill out a little card, and on that card I have them write everything about themselves. And at that point I can determine if there's anything that they can add to the class just by being who they are from their prior knowledge. Tip 2 is to build on existing knowledge and challenge misconceptions. Now, there's a lot of misconceptions that we're going to have when we're teaching adult learners. So it's very important that you put those misconceptions to bed, because we want to make sure that we are giving them the right answers. Remember, some of them may be parents, all of them are patients, and we want to make sure that they have the right information and they're not talking about something that they've heard in a previous situation as they were in a doctor's appointment with a friend, family, or themselves. Tip 3 is we need to facilitate the social construction of meaning using group work. We need to stress the context and the situation. So this is a great thing that we can do because we have the best of both worlds. We can have a flipped classroom so that we have the students learning about a particular topic, and then we walk over and we start practicing that topic. And that's great to bring the content and the situation together. Tip 4 is to use active learning techniques. And there's lots and lots of learning techniques that you can search, and you can even go to our librarian, and our librarian can help you with learning techniques. And tip 5 is to encourage the learners to think about how they learn and give the learners the responsibility for their learning. Some people are going to be audio learners. Some people are going to be visual learners. Some people are going to be kinesthetic learners. So the very first day of class, I actually give the students a test to see how they fall. So I make sure that I hit all the bases when I'm talking about the different learning techniques. I know for me, if you tell me something, I don't understand it. But if you organize it and you present it to me in a way that it's appealing, then I understand what you're talking about. So learners are different. Make sure that you're teaching the student so that they have the ability to learn what you're talking about. Now, one way we can use the constructivist theory is by taking what we've been talking about in the classroom. So a medical assisting student will benefit from the constructivist theory if the instructor provides the student with a handout of instructions and then allows the student to utilize the skills lab to draw up medications for the intradermal, the subcutaneous, and the intramuscular patient's objective injections as described in the handout. Once the student has prepared the injections, the instructor should verify the materials and observe the student perform the injection on the Fanel models. Now, this is a very lifelike situation that will allow the student to incorporate the knowledge received in the classroom and apply the knowledge in the skills lab. Now, you can do this as a flipped classroom, or you can offer the students lab time where they can come in and they can actually perform the skills. And this is just not for clinical, this is also for admin. Now, Denick then goes on to talk about experiential learning theory. ELT was developed by Kolb in 1984, and Kolb attempts to provide a mechanism for how experience can be transformed into knowledge, skills, and attitudes. Denick also provided the following tips to enhance learning in which Kolb's ELT can be used. Tip 6 is that we need to ensure learners get the experiences they need. So if you're teaching an admin class, then it's really important that you have the students learn from the experts. You want to call upon the people that are working in the health foundation and have them talk about what's going on in their individual departments. You also want to make certain that you're having instructors come in that can talk about their different experiences. Tip 7 is reflection. Reflection is helped by logbooks, portfolios, and feedback. Now, a lot of students in the past have used paper portfolios. If they want to do that, that's fine, but make sure that they also have an electronic portfolio. You also want to give the student feedback on all of their assignments. So if you have a discussion, you want to give them feedback. When you're going through the critical thinking exercises, you need to give that student feedback. And it's best to scan the document and put that document into the LMS so that we have that document for the future when we're going through accreditation. Now, please remember that the LMS is gone at the end of the semester. So you may also want to take those documents and put them onto a drive that can be accessed from the faculty. And you can send that information to me, and I can go ahead and put that on the T drive for you. Tip 8 is to build up mental models. These are practical skills and attitudes. You want to look at the scenarios and develop a scenario that is going to allow the student to work in a situation that is lifelike. And tip 9 is to allow learners to engage in hypothesis testing and action planning. There's no reason that they can't take a strip to check the pH of water. There's no reason that they cannot take the urine that we have in the anatomy lab to check the different levels of the urinalysis. have the students think about a problem and then challenge them to come up with a hypothesis and then an action of what they're going to do dependent upon their hypothesis. An example how you can use experiential learning theory in the medical assisting field would be to have the medical assisting students go on field trips in the different departments of the hospital. There's no reason why you shouldn't be doing this. The field trip will allow the students to learn about each department from observation and from interaction with the individuals providing the training sessions. Now these pictures here are actually coming from the college. These are some simulations that occurred in the college, but there's no reason that you cannot take these students into the hospital. They will learn so much if they're going into the hospital. The hospital is just right across the walkway. We need to use the foundation. And finally, Denick describes the humanistic learning theory. The humanistic theories of Maslow and Rogers are the foundation for which we now call student-centered or learner-centered education. Their fundamental learning starting point is the individual's own view of the world, their personal frameworks, and mental models. Denick provided the following tips to enhance learning by the humanistic learning theory perspective. Tip 10 is respect the learners and acknowledge who they are and where they're coming from. Our students have a lot of information. Now you also want to make sure that you find out what upsets our students, because we don't want to be upsetting them because there's something that they're really worried about. So get to know your students. Now don't friend them on Facebook, but get to know your students. Tip 11 is to ensure physical, psychological, and emotional needs are taken care of. You are going to learn so much about your student. Now, if you find that there's something that's bothering them, talk to the student. If you feel that they need help, come to me, and then I will go to somebody that can help that student. Remember, we are all people, and we want to make sure that we take care of the needs of each individual. And tip 12 is teaching and learning is a relationship. I am constantly learning new things every day. And I may come into class and we may be talking about venipuncture, but I may want to talk to them about something that I found out about billing and coding, because it's something that's fresh to me. So if you have new information for them, just talk about it at the beginning of your class period. Begin every class period with saying, hey, has anybody heard anything that's really exciting about the medical profession? Anything new out there? So come up with ideas that are going to be very exciting for the students. To utilize the humanistic learning theory in the medical assisting classroom, you as an instructor should write a topic on the board and then ask the students how they like to learn about the topic. I know this is going to be difficult for you. It was very difficult for me in the very beginning, but sometimes this is helpful to students. Now, day one, I don't think I would do this, but as you get further and further into the program, you may want to do this. So let's say that we were talking about venipuncture. I would write venipuncture up on the board, and I would say to the students, okay, today I want you to think about the arteries, the veins, and the capillaries. And I want you to tell me how you want to learn about those individual topics. And then, based upon what the students are telling me, as an instructor, I should build learning circles and cluster the students into a circle that closely fits the answers the students provided as a way to learn about the topic. So if I wanted students to prepare a PowerPoint, all those students would get together. If I wanted a student to go over to the anatomage table and look at the anatomage table, then I would make sure that the anatomage table is open. So do whatever you can to have your students part of the learning experience. When I was in one of my master's programs, I had the director of Kent State University teaching my class, and he literally gave us each a chapter and said, have at it. Go ahead and prepare the lecture, which at first I thought, this is crazy. But after a while I thought, you know what, this is a good idea because I really didn't know how to prepare a lecture. So when you're preparing for learning, make certain that you keep in mind your students. If they're looking bored, switch it up. Go to something else. So let's take a look at the term learning. In 2005, Gagné defined learning as a process that leads to a change in a learner's disposition and capabilities that can be reflected in behavior. Learning principles add insight into what makes people learn effectively and should be apparent in the instructional process. Now, our program is structured in such a way that you can add to the process, but you cannot take away from the process. So I will have the principles, the goals, the objectives, and the evaluations all written for you. The learning goals that I'm going to give you are broad statements that the instructor would like the learner to achieve. Articulating the learning goals are essential for designing instruction. Now, these learning goals that you're going to receive are going to be measurable. They're going to contain action verbs, and they're going to identify to the learner what you as the instructor would like the student to be able to do at the end of the course. Now, the learning objectives we're going to have are going to be coming, the learning goals we're going to have are going to be coming from the textbook and from the Medical Assisting Review Board. For each individual lecture, you will have learning objectives. These learning objectives state what the learner will be able to do upon completion of the instructional event. Each objective should be measurable and contain the following 4 components: conditions under which the steps are to be demonstrated, the audience, and observable behavior, and the standard for acceptable performance. So what I do each day when I'm getting ready to start the lecture is I write the objectives on the board and I make them very simplistic. That way the students know what we're going to learn for the day. I also, when they walk into the classroom, I will have them take a quiz on the previous chapter. So while they're taking their quiz on the LMS in front of me, I'm writing the objectives on the board for the current lecture that we're going to talk about today. And then I hand out any handouts that I need to give the student for that particular day. Prior to the student leaving the room at the end of the day, I give them an exit ticket. And the exit ticket will have what we just talked about in class. Now, the exit ticket for me tells me if I was able to achieve what we were talking about in the class. So let's say that we were talking about blood pressure. I would have on the exit ticket what is the name of the device that is placed around the patient's arm? What is a normal blood pressure? I will have all that written on the exit ticket because I want the student to know that when they walk out of the classroom. And then as soon as I get back to my office, if time permits, I'm going to go ahead and I'm going to look at these. I'm going to make changes. I'm not going to grade them. I'm going to fix them. And then I'm going to scan them and email them back to the student. The reason I'm doing that is because I want them to look at that to know if they are wrong. Now, what it also does for me is it tells me if I did a good enough job conveying the information to the student that day. If I look at all of the exit tickets and it's not filled out or it's filled out incorrect, then I know that I did not tell the students the appropriate information. And that's kind of like an evaluation. So at the end of any learning process, the student should be given the opportunity to evaluate the learning experience. Now, there are different types of evaluations out there. An evaluation is a tool that is important to an organization. According to Pishkirch, you evaluate for 2 reasons. 1, because someone else wants to know whether the training you designed was effective, or 2, because you want to know. So when I give them the exit ticket, I want to know. But at the end of the semester, you're going to be evaluated based upon your performance as an instructor on the LMS. Evaluations are going to inform stakeholders. Stakeholders are your students, your graduates, your doctor's offices, and also it's going to inform higher education institutions, and they should incorporate evaluations as a tool to allow students to assess their classroom experience and provide instructors feedback to improve their class performance. Institutions report the results of the assessment to faculty, staff, and administration at the end of each semester, and then it's up to each department to meet with their faculty or staff to discuss areas for improvement and to set goals. So we're going to be doing that. I'm going to be meeting with you and looking at your evaluations. Saunders, Trowler, and Bomber have found that evaluation of staff have been added, such as appraisal with assessment of whether targets have been met and whether quality of work has been acceptable. It is possible to see this type of evaluation process as using external quality standards. Faculty evaluations and staff appraisals are ideal for higher education institutions to evaluate the institution and assess alignment with evaluation standards. Evaluation standards are not new to education, and higher education standards should have a department to assess institutional compliance. So our college does have an institutional compliance department that meets with administration, meets with staff, and faculty to make certain that all departments follow accreditation standards. Now, to measure the institutional effectiveness of the medical assisting program, we have chosen to follow the 2015 standards and guidelines for the accreditation of education programs and medical assisting. The 2015 standards were adopted by the American Association of Medical Assistants Medical Assisting Education Review Board. So anytime you hear me talk about MAERB, that's what I'm talking about. And those standards are also adopted by the Commission on Accreditation of Allied Health Education Programs. So if I'm talking about CAHEP, that's what I'm talking about. Now these are summarized as followed. These accreditation standards and guidelines are the minimum standards of quality used in accrediting programs that prepare individuals to enter the medical assisting profession. These standards are the minimum requirements to which an accredited program is held accountable. It's all about accountability. The guidelines are descriptions, examples, or recommendations that elaborate on the standards, guidelines, and they are not required but can assist with interpretation of these standards. So in the 2015 curriculum requirements, individuals graduating from medical assisting programs accredited by the Commission on Accreditation of Allied Health Education Programs must demonstrate knowledge of the subject matters required for competence in the profession. They must incorporate the cognitive knowledge in the performance of psychomotor and affective competencies required in academic subjects. The medical assisting curriculum must assure that all cognitive objectives, as well as the psychomotor and affective competencies, have been achieved prior to the start of any practicum that is a non-paid experience. So prior to our students going out to the practicum, they have to have met all of these requirements. So we follow the standards, and these standards come from the Medical Assisting Review Board, and it is my job to make sure that we are following these standards. The standards that we're currently following are for 2015. Now, as you see, they've changed throughout the years, but right now we are following the 2015 standards. What I do each semester is I take a look at Appendix B and I make certain that everything that we are teaching aligns with these standards. When we're looking at the cognitive, this is going to be any quizzes or tests or homework assignments that you are giving your students. Psychomotor is going to be the skills, either in the skills lab or in the administrative lab. And then the affective are their behavioral skills. And you will also be able to watch the student when they are in the skills lab or when they're in the administrative lab. But ultimately it comes down to this. If it wasn't documented, it didn't happen. So we need to make sure that we have a documentation system that is appropriate so that the Medical Assisting Review Board knows that we are teaching and assessing our students in the knowledge, skills, and behaviors that are recommended for a medical assisting student. Now, in our textbook, we do have standards, and these standards are going to be your cognitive, your psychomotor, and your affective. It is my job to make sure that all of these standards are matching and that I can show the Medical Assisting Review Board that we are testing and we are providing all of these skills to the students. It's up to you to make sure that I have the documentation necessary as proof to the Medical Assisting Review Board. So implementation of best practices is going to ensure that the proper steps are in place to improve upon the needs of the medical assisting program. When medical assisting faculty understand educational theory, they can immerse themselves to determine what is necessary to provide the appropriate theory for the medical assisting student body. Ultimately, it is up to you and the entire medical assisting team to make certain that all medical assisting students receive appropriate training as prescribed by the 2015 MAERB standards. I just want to thank you for all that you do as a medical assisting instructor. It takes a village to raise a student, and without you, this couldn't happen. Because for me, I understand the clinical aspects of medical assisting. I don't have a lot of knowledge in the coding or billing. So it's up to all of us to make sure that we are giving the students the right tools so that they can go out into the world and that they can become the best medical assistant possible. I want people to say, I have an Altman student, and this Altman student was amazing. And this will not happen unless we all work together to make sure that we are providing the necessary training so that our students are ready to go out to practicum and eventually to go out to sit for their credential and become a credentialed medical assistant. So once again, thank you so much for what you're doing for Altman College and for the students that are enrolled in the medical assisting program here at Altman College. Have a good day.